Alcohol-based rubs are used in all clinical situations, for example, before and after patient care, in between patient care, when holding inert objects like pens, and in non-invasive medical devices. This should take about 20 to 30 seconds. Both hand washing and alcohol rubs help to destroy viral microorganisms, fungal microorganisms, and bacterial microorganisms. Before taking temperature, you must ensure that there is no wax inside the ear canal. You then place the thermometer into the ear comfortably for the patient. The average temperature is about 36.8 and today's Chloe's is
37.1. In order to take the radial pulse, make sure the patient is comfortable with arm resting on pillow. The pulse is measured by the rate, rhythm and force. You count the beats for 30 seconds, then times it by 2 to get beats per minute. If patient's pulse is inconsistent, take the pulse for the full minute. A normal pulse is between 60 to 100 beats per minute. If pulse has elevated above 100 beats per minute, it is called tachycardia, and if the beats below 60, bradycardia. Whilst taking the pulse respiration rate, the nurse can take the respiration rate. This alleviates any elevation in the respiration rate from increasing. The normal respiration rate is between 12 to 20 respiration rates per minute.
When taking the blood pressure, you firstly must check if the patient has a fistula or a cannula, as blood pressure cannot be conducted on the arm that either are on. Once identified, sit the patient down and remove any articles of clothing that are in the way. With the arm supported and relaxed, you can now wrap the cuff around the patient's upper arm, making sure the bladder is over the brachial artery. Now a baseline needs to be identified. To get this, you place your fingers on their radial pulse. Inflate the cuff until you cannot feel the pulse anymore. This will roughly be their systolic blood pressure. You now know to go 30 higher than that for a baseline. This is done to avoid giving the patient any discomfort, and at the chance they are hypertensive, in which case you would miss the systolic rate altogether. You now place the stethoscope on the patient's brachial artery. Slowly release the pump, listening for the initial boom sound, systolic. Then, when the beep vanishes, diastolic. The average range for blood pressure is 100/40 or 60/100.